Are you worried that your child may have autism?
Autism spectrum disorder is a developmental disorder where children are diagnosed with a sensory problem, communication problem, and repetitive or behavior issues.
Up next on Carib Nation Health, we're going to be talking about autism spectrum disorder.
Welcome everyone to Carib Nation TV Health. Thank you for being here. We have some wonderful, educated, super moms here today coming to talk to us about their journey in dealing with their child or children who have autism and in the autism spectrum. So first, we're going to talk to Ms. Dakita Brown and second, Ms. Joanne Pyle. And they have so much information for us, and I'm very excited. So let's get started. First question to Ms. Dakita Brown. I would love to hear your personal story.
Okay, well, thank you for having me. I'm very excited to, as always, to spread awareness and to speak on this subject. Personally, I am the mom of a 15-year-old daughter who has non-vocal autism and also sensory processing disorder. And what non-vocal autism is, she uses multi-modes of communication when it comes to her communicating in daily life. She uses sign language, she uses an AAC device, she uses gesturing. She has multiple modes of communication that she uses with us, and it affects her daily. And she also has sensory processing disorder. So sounds and anything having to do with the senses, they're too much for her. So the sounds, the touch, what she sees, it can overwhelm her, and that affects her daily as well. So because a lot of people are not privy to this life, I was basically sharing our story on my personal Facebook page, where I would call it like an autism nugget, like an autism moment. And there she is right now. I was calling it an autism nugget, where I was giving information to my Facebook friends, just saying, hey, when I take her to the dentist, it's a little difficult because I actually have to lay down and hold her, give her a bear hug in order for her to be seen by the dentist. And when I take her to the zoo, we have to go early in the morning because she gets overwhelmed by crowds. So in this case, I was teaching people, I felt, I was teaching people who didn't know otherwise, and I felt that it was important for me to get that word out there. One day I was listening to the radio, and I heard a comedian on his morning show making fun of the persona of a person with special needs, and it really affected me. It actually upset me quite a bit, and so much so that I ended up taking a video of myself, and I wanted him to know that he upset me. So I took the phone and I put it on my dashboard and I recorded this rant, and I let him know, I don't appreciate what you're doing. You have too much money, too wide of a platform to do this. So you should not be doing this. And you hurt my feelings, and you hurt a bunch of other people's feelings. So you need to stop. After that video went viral, people started reaching out to me, and they were like, oh, wow, where are you? Where are you blogging? Where can we find out more about you? And I basically said, I don't blog. I don't do that. I did it on my personal Facebook page. I'm not out here to be a blogger. And that soon changed because I felt like people did want to hear from me, and I'm a brown face. And a lot of the autism moms that are out there are white women with sons. And I can't relate to that. So I wanted someone to be able to see my face and relate to me. So I started blogging. Soon after that, I started special events for the special needs community, where I put on an entire social event, a social production for the community, and it's catered to them. And soon after that, I started with my media correspondence with WJLA in DC. And I do a lot in the community, and it's all for my daughter and the benefit of our community.
That is amazing. I'm so proud of you as a mom myself. I mean, you stood up for your child. So I have to applaud you for that. Thank you. And thank you for sharing your story. This is amazing. So let's hear from
Thank you.
Anne.
I mean, hats off to Dakita. Dakita is an amazing mom. I've had the pleasure of knowing Dakita for several years, and you know, we share similar stories. But in my case, my son is 15 as well, and he is very functional. He is autistic, but very functional. Um, but I do share some of the challenges Dakita faces. Um, DeAndre, my son name is DeAndre, and as soon as he hit that 2-year-old mark, I found something strange going on with him. And I started to question, oh my God, what is wrong with my son? Prior to that, his cognitive level was age appropriate. So I instantly started to get really, really scared. So I took him one day to his pediatrician and I said, look, doc, something is wrong with my kid. Like he was saying 1 to 2 words, following 1 step, 2-step direction. And now he's acting like a 6-month-old. How can you help me? And the doctor looked at me and said, well, he's probably just slow. Maybe you need to give him 6 more months. And I looked at him, I'm like, no, I'm not giving my child 6 more months. Can you please write me a referral? So he wrote me this referral and I took him to Children's because DeAndre was he was prone to ear infections. So instantly I thought to myself, well, maybe if he's prone to ear infection, it will somehow affect his speech. So I took him, we did all these tests, test his brain, do all of this. And the doctor looked at me, she said, ma'am, have you ever thought about your son being autistic? And listen, Dr. Lee said, that was the hardest pill to swallow. So I said, what do you mean? Like he went from being very normal to, you know, acting this way. How can you help me? And she said, she had tears in her eyes and she said, I don't know how to break it down to you, but you need to do the research. At that time, I was working in preschool. I went home and I told DeAndre's dad, I said, I'm leaving that job. So I stayed home 2 years with DeAndre, got him into programs, early intervention programs. I stayed home 2 years and homeschooled him along with the resources that was offered to him. And that right there was the beginning of the road to autism. And I am so happy, even though that pill was so hard to swallow, I'm happy that I did, because if I hadn't taken that step into getting my son early intervention, he wouldn't be the kid that he is today.
Oh, I just had to soak that in.
Yeah.
Because even as a pediatrician, we don't want to tell you anything. We want to see the children thrive, to be
Right.
the best they can be. We don't want to see them go one way or the left, right, or the other. We want them to see them keep going up the mountain.
Right.
And I know it's hard for us. So I am very, very specific when I come up with these things to talk about, and I see things happening, but I also want to be very proactive.
Right.
So I'm gonna ask, this is a big problem as a specialist. Sometimes we do come up and, you know, tell parents, you know, there's some things we're not seeing, we're concerned. So, and it's a problem. We have many patients in denial or just don't want to hear, it's going to be okay, it's so they go to school. And it takes sometimes a month, sometimes 6 months, sometimes years before the parents listen to me as a doctor. So I want to hear with you as a parent, both of you, Danica and Josanne, if a parent is in denial and unsure or refusing concerns from their family, their neighbors, their doctor, what would you tell them today? I'll let you go, Danica, first.
I would say first and foremost, don't be afraid of the diagnosis. The diagnosis equals services. When you have a diagnosis, you get your services. If you shy away from that and you say, I don't want to label my child, a lot of people in the Black community especially don't want to label on their child. They don't want to shrink looking at their child. They don't want a doctor in their business. and they think that they can beat it out the child or they can discipline it out the child. And that's not the case. You have got to get these services. And in order to get the services, you have to come to the realization that your child needs a diagnosis, get that diagnosis, get that label, because guess what? That label will carry them through life. It will get them the services and the accommodations that they need. And that is what you want to help your child.
Mm-hmm.
So that's my first thing. Don't be afraid of that label. You can't be afraid of that.
Very true. Very true. Josanne, what do you have to say on that note? And what are family and friends like in, I know you are from Trinidad and Tobago.
Yeah. Just to piggyback off what Dakita is saying, for me, it's all about swallowing your pride. A lot of these families that come into running with a kid that has autism is their culture. Their culture is telling them, don't accept a child with autism because they're going to grow out of it. Listen, swallow your pride, because you are your kid's biggest advocate. You are the one to do it. So put that aside, put your pride aside, and really just look at your kid and realize that what you're doing is for them, which will be beneficial for you.
Thank you. And I do want to say, I, as a Caribbean American person and doctor, I see a lot of the parents want to use this herb, that herb, this remedy. Yes, beat the child. Yes, put them in a corner, send them by granny, send them by somebody else to take care of them, and it doesn't work. There are specialists to help you. And this time and this moment, virtual help is very readily available. Okay, in your own locality, in your own small little town, small island, there are people that could help you. And if not, there are parents. And I would like Dakita to tell us again about your foundation. How do people hear about or read about your blogging from wherever they are?
So the name of my foundation is Walk One Day in Our Shoes, and my website is www.walkonedayinourshoes.com. Basically, you can find my blogs there. I do Q&As on Instagram every Saturday night. We talk about different topics, anything that you can think of regarding a person with special needs and just what you would like to know, you can find it there on my website. My website will direct you to all of my other social platforms. And I always say it's like a family. You know, people need to know they're not alone. And when they connect with a tribe, when you connect with a group of people who look like you, go through the same things that you go through, when you connect with someone like that, it really does help you to feel that you're not alone, and it helps you along on your journey.
For me, my biggest advice is to take that first step. You as the parent knows your child, and you know your child best. Teachers, educators, doctors see your kid for 15 minutes. A teacher will spend a couple hours, but you are your child's biggest advocate, as I said earlier. Take that first step. There's so many amazing programs that can help you as a parent to accept that your child needs the help. And there's so many programs out there to help your child get early intervention, and it definitely makes a huge difference. So if you are suspecting any type of delay in your child's cognitive or any other areas in their development, please go talk to your pediatrician and get the help that you deserve and that your child deserves.
Okay. And Ms. Danica, besides your wonderful foundation, what other resources have you or do you suggest parents look into if they really want to read before to kind of affirm with themselves, I may have these some symptoms?
So if you see that your child, like I have parents come to me and they say, oh my gosh, I'm so happy I found you, Dakita. Your daughter's just like my son, or your daughter's just like my daughter. And I say, no, they're not just alike. Everyone is different on the spectrum. So my daughter may be non-vocal and your daughter may be non-vocal, but there are other things going on. So Google is your friend. The internet is here. I mean, you can't believe everything you read on the internet now, but you doing a Google search on do a Google search about your child, about their type of autism, non-vocal autism, stemming, which is you hear my daughter, she's stemming, that self-stimulatory behavior.
Mhm,
She's
mhm.
stemming, vocally stemming. Do a Google search and you will start to find articles. You'll start to find other parents who say, this is what my child is doing. And you can really get into that groove and kind of get that support that you're looking for.
I want to thank both of you ladies for coming on. Miss Danica Brown, Walk One Day in Our Shoes Foundation, and Josanne Pyle, please put out where we can find you, Josanne, for your followers, if you would like people to follow you.
um, my Instagram handle is Josie Lash, and my Facebook page is Josanne Pyle, and that's Pile. I don't really post a lot about my son on social media just because of custody issues. I don't, but I am very open. My hashtag all the time is a Black autism mom. I am really, really open to people reaching out to me and asking me questions because, we need to help each other at this point.
Yes.
We really do.
Yeah.
And Dakita has helped me a whole lot.
I love it. Sisters helping sisters. Love it. All right. Well, we'll end on that note. And we want to thank Josanne Pyle and Dakita Brown here for visiting us on Carib Nation TV Health. Thank you. Have a blessed evening. The interview with the two autistic mothers was really amazing. I was so pleased to learn so much from them. Their journey, their struggle, has been, so impressive. And the most important thing that I thought that they taught us today was to build a community. Find other parents and mothers, other fathers who can help you, learn from each other what's best in your community to do for your child. Now, Dr. Nix, I know you're going to interviewed Miss Rosalind Cyrus, our occupational therapist. So excited to hear.
Yes, I did. So I had a meaningful and eye-opening Q&A session, question and answer session with Miss Rosalind Cyrus. So you realize that managing or the treatment of an autistic child has to be a multidisciplinary approach. And I learned the importance of an occupational therapist in the management of an autistic child or child with autism spectrum disorder. Thank you for joining us, Ms. Rosalind.
Thank you.
What is the role of an occupational therapist with patients who are diagnosed with autism spectrum disorder?
The role of occupational therapy is to help the individual to perform their daily activities successfully, pretty much using coping mechanisms, using compensatory techniques, and depending on how we go about to get them to learn this skill, because it's a sensory processing that is also disorganized, given that it's neurodevelopmental involvement. What we have to do is take those which the person has, organize it for them, break it up into sequence steps, and allow them to participate. I know that there is autism awareness in the Caribbean.
Yes. Oh, yes.
Yeah. I recently presented with another professor for another group regarding autism in the diaspora.
Right.
And part of it I addressed the Caribbean islands.
Yes.
And from my research, Aruba was studied by a group of interdisciplinary team. And the reason why they selected Aruba, because of their healthcare system being organized and having things in place and access to children or individuals who may be on the spectrum, but through assessments, they were able to do a study that shows that some of us, meaning when I said us, Caribbean parents, caregivers, may not know that their child is on the spectrum.
Right.
Because of autism awareness being introduced, and I would not say introduced as now introduced, but probably is beginning to be accepted
Yes.
on different islands. There are more vocalization of the disorder. So no longer are some parents taboo of shutting up their child away because they think they're dumb or they think they're deformed, for lack of a better word that they use, and all the negative words that they use to describe a child. No longer, I believe, this is
Yeah.
shut in.
Yes, I get the impression that it's more accepting, they're accepting the diagnosis and parents are, feeling that they should seek some help and
Yes,
intervention.
yes.
Yes. Um, so are there any newer modalities of treatments or therapy on the horizon with your field and how you take care of children with autism?
So the way we take care of children who are diagnosed with autism, first of all, we get the referral from the pediatrician, and each child is assessed. No one autism treatment plan is acceptable for another child. Each child would have a different type of the spectrum, but similarly, we know is sensory processing.
Yes.
That's the problem. You may have a child who needs to be desensitized before they can attend to a task. You may have a child who need to be deep pressured, wrap them up into something like a tight blanket or weighted vest or such, so that they can attend to a task. And in that window, you have to break up the steps into parts and a lot of repetition depending on the age. But we know that success is there. However, there are different aspects of autism where a parent may feel as though I do not see any change with my child. So, what can you do to help my child? And in this case, we would then probably introduce assistive technology depending on the age of the child.
How do you reassure a parent when faced with a challenging situation? For example, when you're seeing a nonverbal child?
We know that the first language for a child is sign language. Um, so throughout their milestones, when they visit for their follow-up with their pediatrician, and the pediatrician would ask question, are your child doing is your child able to participate in this activity? Is the child engaging in communication, whether it is one word, two words, depend on their age. But if a child should be at a certain age should have vocalization and intelligent speech, however, is not displaying this type of communication, what the occupational therapy would do is introduce assistive technology, one. Two, because of our IDA Act here in the US, No Child Left Behind, meaning inclusion. The
Yes.
child will be with other children, whether they have developmental delays or normal children without disorders, in the classroom, interacting, because children are like sponge. Their
They
brain is
are.
still developing. So
Yes.
they end up making sounds. They would also have speech and language pathology involved in their speech. But to communicate, given a certain age, to communicate, we can introduce assistive technology where the child would understand to press a certain figure on there that would vocalize for them. But that is in the later stage when it is clear that this child may not have vocalization.
How can we address this in our communities, in general, and also in our Caribbean communities, autism spectrum disorder?
In the United States, in our communities, in the underserved, underprivileged communities, I would say advocating. But it's not such of a big problem here because the government, local schools, and there are therapists there in plentiful. And
Yes.
besides that, there are also outpatient clinics where children can go there, get the academic part at school, get the self-care part in outpatient clinic or at home therapy, whatever that is a recommendation from the pediatrician, from the psychologist, from the interdisciplinary team. The student would have an IEP,
Yes.
and which would address what setting the child can learn, depending on how much of a need this child may need. In terms of in the Caribbean, I think more resources, more education. I think it's probably it's an emerging practice. It's an emerging understanding by the community. So more community education, caregiver education, resources, because you don't want those who are there now, those meaning the therapists, the pediatrician, the interdisciplinary team, to be overwhelmed, because I do believe that there are more than a handful of autistic children or children who are on the spectrum in the Caribbean island who are
Yes.
not being addressed.
Thank you so much for answering
welcome.
all our questions. I really appreciate your time. Dr. Sindas, we realize that it is really important that our patients seek care with their pediatricians or seek primary care, especially for their health supervision visits. And the importance of this, especially during this time, is that we do not want to miss patients who may have autism spectrum disorder, developmental disorders in general. So yeah.
So true. We want this show to highlight the fact that children less than 3 years of age need to be in touch with their medical provider, their pediatrician, their nurse in their community who can help them see and make sure that their child is on point with their development for their age. At 6 months, we know children sit up.
Yes.
At 1 year, you should be speaking 3 words. 15 months, you're going to be walking backwards and forwards. So children have certain things that they are supposed to do for each age. And if they are not, we would like to know that so that we can help your child and help you deal with the developmental issues that may be something of concern for you and your family. And
Yes.
as other mothers instructed us, when their children did not fall in line with those developmental guidelines, they went and looked for help. And that's what I want you to do today. If you don't have Wi-Fi or anything, maybe you ask your church, ask your neighbor, ask someone to help you. But ultimately, we need you to see your pediatrician in your community.
Yes, please look out for the red flags. It's very important because we want your child to develop normally. So if you notice anything, any problems with interaction, and when your child is seen by the physician, then screening questionnaires are given.
We are here at Caribbean Health. We are looking for ways to help our community and get the word out. So please contact us, subscribe and like our channel on YouTube, Caribbean TV.
So where can they find you, Dr. Sindas?
Well, myself, I am a holistic pediatrician, and I am at fireflywellnessmd.com. You can email me at fireflywellnessmd@gmail.com. And what about you, Dr. Mix?
Well, I'm with Rodocs. That's ROWEDOCS. You can find me at www.rodocs.com, or you can find me at drkiananix.com.
All right.
Yes. Thank you for joining us. Thank you for tuning in, and see you next time.